Hey everyone, welcome to my channel. Thank you for spending some time with me yet again. I appreciate all the new subscribers. Thank you. And if you haven't subscribed, please make sure you do so. That helps push my content even further. And then also, if um, you need additional support, then you can also look at the other videos, and I will put that information at the end of this video session. So today, Study With Me is going to be covering the topic of counseling and helping relationships, which is actually one of my nice, lovely favorite areas that I like to go over when I'm doing tutoring. And we'll just go over it together. So, if you don't have your Rosenthal book, go ahead and grab it. I will give you some time to get that information. And then if you do need additional time, you can always pause it here and then you can just go from there. How about that? All right, so we are looking at question 1. So, Sigmund Freud is the father of psychoanalysis, which is both a form of treatment and a very comprehensive personality theory. According to Freud's theory, inborn drives mainly sexual help from the personality. Blank and Blank, who originally worked with Freud, created individual psychology and analytical psychology, respectfully. So we're looking for the theorists who created the individual psychology and the analytic psychology. So when we're looking at these options, which ones do we know? I'll give you some time. All right. Let's show the answer here. So Alfred Adler and Carl Jung. Okay. Alfred Adler was the father of individual psychology, and Carl Gustav Jung, or Jung, founded analytic psychology. Eric Berni's transactional analysis posits 3 ego states: the child, the adult, and the parent. These roughly correspond to Freud's structural theories that indicates or includes which are the following. So we're looking at how the concept of Sigmund Freud's structural theory is similar to Eric Berne's transactional analysis. So now, if we had to choose and we had to look at the child, the adult, and the parent, which one would you choose? Let's see what the answer is. The id, ego, and superego. Yes, right? We have the id, the kid, the child, the ego, right? Which is the parent, and the superego, which is the adult. Let's go to the next one. In transactional analysis, the blank is the conscious or ego state concerned with moral behavior, while in Freudian's theory, it is the, so we're looking for 2. In transactional analysis, the blank is the conscious. So we're looking for what is the conscious in transactional analysis, and also how is it related to one of Sigmund Freud's construct theory of the mind. Yes, so parent and superego. The parent is the individual in our life that gives us the information from the right and wrong, right? What's morally acceptable and what's not. Same with the superego, right? The superego looks at the consequences of actions and wanting to get the best out of a decision that is being made. Freud felt that successful resolution of the Oedipus complex led to the development of the superego. This is accomplished by identification with the aggressor, the parent of the same sex, analysis during childhood years, identification with the parent of the opposite sex, the aggressor, or transference. Now, we can definitely rule out transference because transference is when a client projects their feelings onto you. We can also knock out analysis during the childhood years as well. So when you think about the the Oedipus complex is the most controversial area in Sigmund Freud's psychosexual stages. And if you remember, the mnemonic way to remember them in order is old age people love grapes. Old age people love grapes. So in the Oedipus complex, the boy, for example, would have the aggression towards the same sex parent, which is the father, but also has the sexual urges to the opposite parent. Okay. So keyword, I just said aggression towards the same parent. So that will lead you to what option? To A. So remember, the Oedipus is also part of the phallic stage. So when the child is able to resolve and move on to the superego, they also move into latency where they no longer have those urges anymore towards the opposite parent and the aggressive behavior or thinking towards the same sex parent. Freudians refer to ego as the executive administrator of the personality and the reality principle, the guardian angel of the mind, the pleasure principle, or the seat of the libido. Now, have you heard of the seat of libido with Sigmund Freud? Eh. But have you heard about it in regards to the ego? Nope. So we're going to exit that out. So next, we're going to go to the pleasure principle. When you think about the pleasure principle, we think about the id, right? The id, kid, right? Primitive thoughts. I want what I want. I don't care about the consequences. So it wouldn't be the ego. The guardian angel of the mind. Definitely not the answer. It would be nice, but it's not the answer. Okay. So this will lead us to the executive administrator of the personality and the reality principle. You think of the ego as in the front of the mind, the representative that we all see. The ego also balances out the id and the superego in making the final decision and acting on it. Freud's theory speaks of Eros and Thanatos. A client who threatens a self-destructive act is being ruled primarily by A. Eros, B. Eros and the id, C. Thanatos, I'm going to say that a little weird, and then D. Both Eros and Thanatos. Now, if you don't know what it is, we can just talk about it together, but let's talk about what answer we can rule out. We can rule out Eros, and id because id is what? The pleasure principle. We're not talking about the pleasure principle here, so we're going to take out B. Now, we have to know the definition of the terms in order to make it applicable. So remember that the NCE CPCE is a definition test because you have to be able to define it in order to make it applicable. So it's both a definition and an application test. So Eros is the definition of light and love. So we will rule that out because it wouldn't be A because we're not talking about light and love. Then we will rule out D because D says both Eros and Thanatos. So then it would leave us with C, Thanatos, right? Thanatos, people usually refer to marvels, right? The evil, self-destructive or destructive person of death and everything else. So they would think of Thanos. The id is present at birth and never matures. It operates mainly out of awareness to satisfy instinctual needs according to and we just talked about this, the reality principle. No, we just talked about that. That was the ego, right? Notion of transference. We're not talking about transference here, right? I'm talking about the client transferring negative behaviors or projecting their feelings onto you. Eros principle, we just said Eros was what? Eros was light and love. So then we're going to go to D, pleasure principle, which is the correct answer. If you think of the mind as a seesaw, then the fulcrum or balancing apparatus would be and we talked about this a little too about, I'm not going to give you the answer because I was about to give you the answer, but A is id, which has no concept of rationality or time. So do you think the id would be the balancing apparatus? Because we just said that never matures. It never matures. It wants what it wants. It's instinctual. It's a primitive part of our brain. So there's no balance in there. The id's going to want what it wants, no matter what the consequences are. So we're going to rule out A. Ego. Okay, so we said ego is the reality, right? The executive, the decision making, right? And balances out. And the key word I just gave you was balancing out, right? So we'll be ego because ego needs to be able to balance out the one of the id as well as the superego and make that decision. So it would be ego. A therapist who says to a patient, say whatever comes to my mind or to your mind is practicing. Directive counseling? No, directive counseling is saying this is what you need to do, and we will follow up when you come back to your next therapy section, right? I'm telling you, I'm directing you, telling you exactly what you need to do. It would be B, right? Because B is transactional analysis. Transactional analysis, Eric Byrne. He talks about how we communicate. Transactional analysis is the transition of conversations that we have with each other and how that conversation can lead to unhealthy conversations. Paraphrasing, I am not taking what someone is saying and I'm not making it into my own words in order to sum up what the client is saying. So we're going to go with D is free association. Is to freely say and associate whatever you want to talk about pretty much. Superego contains the ego ideal. The superego strives for blank rather than blank like the id. So the options here, we're looking for what the superego strives for and rather than what the id strives for. So we need two answers. First one is perfection and pleasure. So does superego strive for perfection and rather than pleasure like the id? Could be. And then B has the same option. Um, and then morals and ethics. Does the superego strives for morals while the id strives for ethics? Then you have D, the superego strives for logic, and the id is for reality. So we know reality is the ego. So we're going to take out D. We know ethics is not with the id, so we're going to rule out C. And so it has to be between A and B. And because we know that the B, pleasure and perfection, the id does not care about perfection. Okay. Just want what it wants. So we're going to rule out B and we're going to shoot to answer A. So the superego strives for perfection rather than pleasure like the id. All of these theorists could be associated with the analytic movement except psychoanalytic theorists. We have the option of Sigmund Freud, Carl Jung, Alfred Adler, and Joseph Wolff. Now, who do we know out of these options that are psychoanalytic theorists? We can definitely say Sigmund Freud. We're going to say Carl Jung. Yes. Yes. Alfred Adler. And that's it. So all we have left is Wolff. Now, what do you know about Joseph Wolff? So Joseph Wolff talked about the systematic desensitization, right? He worked with the SUD scale, subjected units of measurements, right? And he used that to assist patients with rating their, for example, anxiety on a scale of 1 to 100, right? And with that, you will be able to see where the client has the least anxiety or the worst anxiety, and you will slowly expose them to that. Okay. And it's also a form of behavioral therapy. So subjective unit scales. Most scholars would assert that Freud's 1900 work entitled The Interpretation of Dreams was his most influential work. Dreams have the following: manifest and latent content. Okay. Then we have preconscious and unconscious factor, id and ego, and lastly, superego and id. So we're going to rule out superego and id because we're not talking about pleasure principle. We're not talking about superego. We're not talking about any of those mental constructs that he talks about. We're trying to understand dreams have the following. So we're going to take out C. Well, yeah, C for id and ego. And then we're going to have just A and B. B is preconscious and unconscious factors. Now, if we're in dreaming, we're not going to be in the preconscious, right? We can't easily access our dreams from remembrance because we're already dreaming, right? So it's going to be A, manifest and latent content. So the term manifest, right? Term manifest means the surface meaning, right? The surface meaning of something that we might dream about and maybe we're scared, but the hidden meaning, which is the latent content is, but why are we afraid? What are we afraid of, right? So it's kind of like digging deeper into your dreams. Sigmund Freud used that with hypnosis as well. When a client when a client projects feelings towards a therapist that he or she originally had towards a significant other, it is called what? We can for sure rule out free association. We said that was when you just talk about whatever you want to talk about, right? Insight. Well, do you think this person who's projecting is having insight? Project, you think towards something, projectile, right? So it's not insight in towards oneself, right? Inward, you think of insight, not that. Transference. Yep, definitely. We talked about this before, right? Transference is transferring your feelings towards the therapist. Resistance wouldn't be an option because there is no resistance from this person. They're actually moving towards the least resistance and expressing themselves. Okay. So transference. For which case is not associated with the psychodynamic movement? Okay. Which case is not keyword not associated with the psychodynamic movement. We have little Hans, we have little Albert, Anna O, and Scruber. Okay. All right. So, what do we know about little Hans? What do you know about little Hans? Let's get some thinking going. So, little Hans worked with Sigmund Freud. He was a little kid. He was afraid of getting bit by horses in the streets. He had a fear of going to the streets and having the horse bite him. So he worked with Sigmund Freud. So we would scratch that out because that's part of the psychodynamic movement. Next, we have little Albert. So little Albert, he worked with John B. Watson. And John B. Watson was into behaviorism. And so he had a 9-month-old boy named Albert. He introduced furry objects to him that he found enjoyable, but then he also added later a loud cracking noise on a steel bar and scared the boy. So John B. Watson wanted people to know that that phobias can be learned. So he conditioned the child to be scared of the furry animals, and unfortunately, he never ever desensitized the little boy from being afraid of the white rat and the bunny rabbit. He just lived with that until he passed away. Sad story, I know. I didn't mean to get that deep. So was little Albert with John B. Watson a part of the psychodynamic movement? Nope. So little Albert is the answer here. So let's talk about Anna O. All right. So Anna O was a case in like the 1880s, right? And was considered the first psychoanalytic patient. So she suffered from symptoms without an organic basis, which was termed hysteria. Okay. So you have Daniel Paul Scruber. He worked with individuals and he indicated that major delusion was that he would be transformed into a woman. So he worked with a client, and the major delusion with the client was that he would be transformed into a woman and become God's mate and produce a healthier race. This is Scruber himself. Okay. Freud said Scruber might have been struggling with unconscious issues of homosexuality. Interesting. All right. Go to the next one. In contrast with classical psychoanalysis, psychodynamic counseling or therapy utilizes few sessions per week. B, does not utilize a couch. C, is performed face to face. Or D, all the above. So we're looking at the comparison between psychoanalysis and the psychodynamic movements. So if we're looking at psychoanalysis, right? Psychoanalysis is not something that's used a lot today because there is no end date, right? It's more considered like talk therapy in a sense because you're just talking. And there hasn't been as much research on the effectiveness of using psychoanalysis with a client. So there are some insurances that will not, I haven't seen any insurance that would accept an intervention like a modality of psychoanalysis with a client. Then you have psychodynamic, right? Psychodynamic has fewer sessions, right? Um, so fewer sessions, and then you think of they don't always use a couch, right? You don't have to utilize a couch, and it's performed face to face. So it's going to be all the above. So with psychoanalysis, you have the chair facing away from you, right? Think of Sigmund Freud. You utilize the couch in that sense, right? And you have a lot more sessions. Talking about difficulties in order to purge emotions and feelings is a curative process known as keyword purge emotions, right? Purge emotions and feelings, right? So if I'm purging emotions and feelings, I can automatically eliminate resistance because resistance means I'm not giving you anything, right? There is no accurate empathy here, right? Reflection of emotional content. I'm not reflecting on anything. I'm literally purging myself. Also known as, like, you think of trauma dumping or just someone coming in just spilling everything about themselves, right? So we're going to go with A, catharsis and aberration, right? So we're going to show the answer. Yes. So this is the definition of purging emotions and feeling is a curative process. Curative process means that it's very helpful for a client to do that. And it can help alleviate some symptoms because they're purging their emotions out to you. And maybe they've been keeping it in for a very long time. Id, ego, superego is to structural theory as blank is to topographical theory. Now, this is an interesting one. Um, I had to bring out the topographical chart on this one, and I'm considering bringing it out so that I can show you what that would look like. So, whenever you think of topographical theory, topographical describes land, water, whatever, to describe some area. So, we're talking about the id, ego, superego is the structural theory as blank is to topographical. So we're trying to look at what did Sigmund Freud put on or demonstrate with the topographical theory. Well, we know he didn't do child, parent, and adult because that's transactional analysis. Just talked about catharsis. It's not purging of emotion, and we know it's not ego ideal. So it's the unconscious, preconscious, and conscious. So what I want to do is I want to pull up the topographical model so you can see if I can get my spelling right. Okay. So topographical model is the construct that Sigmund Freud put together to explain the development of the mind. Okay. So there's one that I enjoy using the most. That's very helpful. It's definitely not this one. Here it is. I love this slide. So theory of personality. This is how he explained the construct of the mind. This is a topographical iceberg that Sigmund Freud talks about. So he has the unconscious, the preconscious, and the conscious, as well as the id, superego, and ego. Okay. So you have the id that's completely in the unconscious, right? The primitive part of us that never changes, never matures. You have the superego here, where there is um, morality, right? Morals, right? Good, right, and wrong, right? You have it in the unconscious as well as the conscious part of the mind. And then you have the ego, which is still in the unconscious, not as much, but it's more so out here in the reality. Okay. So this is how he explains the process of the mind. So we have thoughts. Maybe I might want the ice cream. I'm going to take it, right? If I'm the id, I'm going to go take it. I don't care about the consequences. But the super ego is like, hold on, wait, before we do that, let's think about this. let's see if we can get it in a better way that doesn't um offend someone, hurt someone, or it's not socially acceptable. And then the id who balances out the id, the ego that balances out the id and the superego makes that final executive decision and says, oh, you know what? To satisfy the id and the ego, superego, I'm just going to go ahead and buy that ice cream. Okay. So think about it as a way of thinking, right? You have the id, superego, and ego, right? Ego has the final say. Looking at the preconscious is when you, for example, you know the name of the song, but you can't think of it right now, but you can access it. You can hear the song, but you can't think of the name of the song. And then later on, maybe you'll be able to get the information easily because you just remembered it. So preconscious is right here, right below the conscious, right? It's easily accessible versus the conscious being all the way down here in the unconscious mind. So preconscious is something that is easily accessible through attempts of trying to regain that memory back. And sometimes it just happens when we're not even thinking about it, right? Okay. So I hope this has been helpful. But whenever you think about the topographical, you're going to think about this iceberg and think about the process of thought that Sigmund Freud said we go through, which is the id, superego, and ego. And then we have the preconscious, which is information that we can easily access, whereas unconscious is where we have to dive deeper, right? Imagine a diver going all the way to the bottom. And consciousness is what we are in the reality of at that moment. Okay. I hope that was helpful. The most controversial aspect of Freud's theory is, and we talked about this, catharsis, we said, is a purge, right, of emotion and feeling. So it wouldn't be this one. Oedipus complex, we talked about this. This is the most controversial, right? Because we talked about, for example, the boy having sexual urges towards the mom and then anger towards the same sex parent, which is the dad. The notion of the preconscious mind, nope. The interpretation of dreams we talked about with the manifest and latent content with Sigmund Freud's interpretation of dreams. So, yep. Evidence for the unconscious minds comes from all these except. So, remember I said the subjective units of scale, of the stress scale? Who was that? And you can remember that. If you said Joseph, what was his name? Watson, right? Watson. So he talked about how we learn, right? We can learn about phobias. Like phobias can be learned. Okay. So with that being said, we know for sure it's not him, right? He does not talk about the unconsciousness. He talks about the consciousness of learned phobias. So we can go ahead and eliminate that. So hypnosis was something that Sigmund Freud used. Slips of the tongue and humor. Now let's talk a little bit about that. So slips of the tongue and humor relates to, say for example, if I said something that I knew I shouldn't say, like maybe I said, oh my God, that dress is ugly, and I know I shouldn't have said it, but it slipped, right? Remember we talked about the topographical, how the process of the mind works. So maybe the id gave the slip and it ended up coming out of my mouth through reality with the ego. And it's like, oh my gosh, I'm so sorry. I don't know what came over me. I don't know why I said that. I'm so sorry, right? Slips of the tongue or humor, right? Maybe you say something that's really funny that you don't really think about saying, right? And you just say it without even really thinking about it. So that's like it slips through here or there. Hopefully not too much though. But that's what that means. So John B. Watson is here. He worked with little Albert. In a counseling session, a counselor asked a patient to recall what transpired 3 months ago to trigger her depression. There was silence for about 2.5 minutes. 2.5 minutes. The client began to remember. This exchange most likely illustrates the function of, is it the preconscious mind? Now, we just went over the topographical model, right? What did we say with preconscious? Preconscious is information that's easily accessible, but takes time to get, right? Takes a little bit of short time to get. So we already know it's the preconscious, right? It wouldn't be the ego ideal, the conscious mind. I mean, we can say it's in the conscious mind, but not really because we don't have it readily available, like in reality. So we have to think about it. But it's not in the unconscious mind because that's further down. That's what the deep dive is, right? Then we have to do some self-reflection. Unconscious processes which serve to minimize anxiety and protect the self from severe id or superego demands are called slips of the tongue, ego defense mechanism, id defense, id defense mechanism, and latent dream material. So we know we can already rule out latent dream, right? Material, because that's what Sigmund Freud, right? His dream interpretation of dreams, right? So we're gonna rule that out. Id defense process. Does the id have any defense process? Nope. It wants what it wants. There's no defending anything. So we're gonna take that out. Ego defense mechanism, right? Ego defense mechanism is the correct answer because the ego is a reality. It's what we see, what we hear, everything in reality. And so we have the id defense mechanism that pushes all those stimulus that we can't process and pushes it back into the unconscious mind, so that we don't have access to the information to defend ourselves. And then we have the slip of the tongue, which we talked about before, which is when the id sometimes get out and we don't expect it. Most therapists agree that the ego defense mechanism denies or distorts reality. Rationalization, compensation, repression, projection, reaction formation, identification, introjection, denial, and displacement are ego defense mechanisms. According to Freudians, the most popular or most important defense mechanism is. So, according to Freudians, sublimation. Let's look at that. So sublimation is taking a behavior that is unacceptable, maybe like fighting in the streets, and substituting that with something that's more um, readily accepted, like boxing, right? So I can fight and get paid and be applauded. Okay, I'm gonna do that. Denial is denying that something has happened, but Sigmund Freud doesn't talk about denial, right? Reaction formation is doing to yourself what you want to do to someone else. And then we have repression. Repression is the mind's defense mechanism where it is automatic. We have no control over it. We don't know what's happening. And that's like a defense mechanism. So it's going to be A. Suppression differs from repression. So we're looking at the word suppression and repression. We just learned that repression is something that we can't control and that is done to protect us from current stimuli, right? We don't even know that we're doing the repression. So let's look at the options here. Suppression is stronger. Can't really say that, right? It depends on the situation. So repression only occurs in children. That's not true. Repression can occur and happen to anyone. We know it's not all the above because you just ruled out A and B. So then C is repression is automatic or involuntary, right? Like I said before, repression is a defense mechanism where our brain automatically, the ego automatically pushes it to the back of the mind where the id is into the unconscious because it's trying to protect us from the memories and the emotions that we have with trauma or with an unhappy event. An aggressive male who becomes a professional boxer because he is sadistic is displaying. Now, will we say suppression? Is this person suppressing their feelings automatically, knowingly? No. Rationalization? No, this person is not rationalizing anything. Sublimation, we talked about that. Substitute one behavior for something that's more acceptable. Displacement, we're not going to say displacement. So displacement is more so of being out of a place where, you know, another defense mechanism that occurs typically when an impulse is unleashed at a safe target, right? So displacement is when you're moved out of your own place of thinking, right? Can be associated with like disassociation, right? So if we had a look at suppression, rationalization, sublimation, displacement, which one would we go with? We would go with sublimation, right? You think of sublimation as substitute, okay? All right, let's go to the next one. An advertising psychologist secretly embeds the word sex into the newspaper ad, intends to advertise his center's chemical dependency program. This is the practice of sublimation, A, repression, B, C, introduction, or D, none of the above. Now, this person is not substituting the word sex for something else, right? It's more acceptable. He just put the word sex in there, right? Repression, this person is definitely not repressing anything. Introduction is inward into oneself. So it will be none of the above, right? A man receives a nickel an hour pay raise. A nickel an hour? Mm. Okay. He was expecting a $1 per hour raise. He is furious but non assertive. He thus smiles and thanks his boss. That night, he yells at his wife for no apparent reason. That sounds like a jerk move there. This is an example of what? We talked about displacement, right? It's a defense mechanism which occurs when an impulse is unleashed at a safe target. I don't think that's a safe target. His wife definitely not a safe target for him to displace that. Um, so it could be a denial, definitely not denying anything here. Identification, and then D type 1 error. That's the beta, right? That's when you have a false negative. So we're not talking about statistics right now. So we're gonna talk about displacement, right? You take out, you take your anger and you displace it on something else that you're not really mad about, right? Definitely not a good thing. A college student tells a college counselor that he is not upset by a grade of F in physical education that merit his fourth year perfect 4.0 average. So he goes on to say straight A students are eggheads, right? Because he got to know. So introduction, he's not looking into himself. Definitely not. Reaction formation, he's not doing something to himself that he wishes to do to someone else. So we can look at sour grape rationalization. When you think of sour grape rationalization, you would think of someone being a sore loser, right? They are acting really sour about it, right? So in this case, do we feel like the college student is acting very sour, acting very like a sore loser in a sense? And the grapes will indicate like it's not as good or as sweet as it was anyway to get straight A's because straight A's are for eggheads. Sounds about right. But let's look at sweet lemon rationalization. Sweet lemon rationalization is thinking something sweet when it's actually bitter. It's actually not that great. Like you might say, oh, I have a new job. I'm making a lot more money, but the job I'm working days and nights, right? But at least I'm making good money. Well, that's saying it's sweet, but you also have parts of it that are not great, right? So you're probably just overselling what it is, right? To convince someone else that where you are and what situation you're in is very sweet, but it's not. So we had to go between sour grapes and rationalization and sweet lemon rationalization. Which one would you go with? If you pick C, you would go with sour grape rationalization because you think about him being a sore loser, right? All right. A master level counselor lands an entry level counseling job in an agency in a warm climate. Her office is not air conditioned, but the counselor insists she likes this because sweating really helps her keep her weight in check. This illuminates sour grape rationalization. No, she's not sour about anything or complaining about anything, right? Sweet lemon, definitely you make it sound like it's real sweet, but the sweating part is that bad that you lose weight. It's probably not as sweet as you think it is. Repression, definitely not. Sublimation, no. So we're gonna go with B. A teenager who has his heart set on winning a tennis match broke his arm in an auto accident. He sends in an entry form to play the competition, which begins just days after the accident. His behavior is influenced by A, denial, B, displacement of anger, C, sublimation, or D, organ inferiority. So let's just go over. Organ inferiority is with Alfred Adler. He was sick as a little kid. He couldn't walk. He had some health issues. And for him, he felt inferior because he couldn't do things kids his age could do. And so he called it organ inferiority, in which he states that the goal of a child in the social group is to feel connected, but also to prove that they are superior, right? And he worked with children in group settings. Sublimation means to substitute one behavior that's not acceptable for one that's more acceptable in society. Displacement of anger is taking your anger out on someone else when you're really want to direct it to the actual original target. This would be denial for this person who broke their arm and days later still wants to sign up to play competitively. Blank is looking in the mirror but thinking you are looking out a window. Okay, so looking in the blank is looking in the mirror but thinking you are looking out a window, looking out a window. It's not going to be a repression because this person's not repressing their feelings, right? We wouldn't even know because that would be something that's automatic, right? Sour grape rationalization. This person is not complaining about anything and they're trying to rationalize someone else's success. Projection, projecting how you feel inward, like but you also like projecting that outward, right? So it's like what I'm thinking and I'm projecting that. So it would be C, projection. Projection is looking in the mirror, but thinking you are looking out a window. So it's like all about your perception, right? You can think of projection, you think of perception. Okay. And then next you have denial. So we know it's not denial, okay? So it would be projection. Okay. All right. So we got to 30. I was doing 25, but I was on a roll. So I was like, let's just go with it. I hope that you enjoyed the explanations. Please let me know if you've learned anything from this in-depth review of counseling, help, and relationship using Dr. Rosenthal's purple book. And then make sure you like and subscribe to the channel. I'll be doing another topic. I'm thinking that I might do, let's see, I might do groups next. I like groups. So thank you again, and make sure you like and subscribe and hit the notification buttons. And then you can also look at the next video where I talk about in-depth review of human growth and development. All right. Thank you and have a great, amazing night.